This slide is about DRP number 5, which is about adverse drug reaction. This DRP has no equivalent to PCNA version 8. Adverse drug reaction occurs when a drug product causes an undesirable reaction that is not dose-related, or if there is drug interaction causing an undesirable reaction that is not also dose-related. Also, ADR is related to incorrect administration, and it also happens if a drug product causes an allergic reaction. Also, if a drug or the dosage regimen was administered or changed too rapidly, an ADR might happen. And the drug product is contraindicated due to risk, and a possible ADR also can happen. Example: the patient has developed a rash covering his upper torso and arm caused by cotrimoxazole he was taking for a treatment of a wound infection. If the patient has a negative reaction to a drug product, it is considered an adverse drug reaction. The resolution calls for discontinuing that product and identifying that one would likely be effective and would also be safer to the patient. Let's compare this type of drug therapy problem with those undesirable events that are caused by the patients receiving too high a dose. In these cases, the remedy is most often to reduce the dosage regimen. So remember that always. You have to address adverse drug reaction the same way with if a patient is taking a drug too high. Adjust your dosage regimen. It is important for pharmaceutical care practitioners or you as clinical pharmacists to distinguish between undesirable events that are dose-related and those who are not. Hence, if you have adjusted already the dose and the patient manifestations are not being resolved, that is categorized as adverse drug reaction and not dose-related. These are drug products mostly involved in adverse drug reactions. We have here quetiapine, Seroquel, donepezil, Aricept, memantine, Namenda, Metformin, Glucophage, simvastatin, Zocor, clopidogrel, Plavix, lisinopril, Prinivil, tramadol, Ultram, levothyroxine, Synthroid, and amlodipine becylate, Norvasc. On this slide is about drug-related problem number 6, or dosage is too high. It has the same thought with C3.2, C3.4, C4.2, C5.3 to 4, C6.1, C6.3, C7.2 to 3, and C7.7 to 8 of PCNE version 8. This DRP talks about a drug product that has a dose that is too high, resulting in undesirable toxic effect. There's need for additional monitoring in order to determine if this dosage is really too high. This dosage too high can be a result of a frequency that is too short, a duration of a drug therapy is too long, or there is a drug interaction resulting in a toxic reaction to the drug product. Example: the patient developed bradycardia and second-degree heart block resulting from a 0.5 mg daily dose of digoxin used for congestive heart failure. So, what do you consider? Is it a dose too high or just correct? Oh, this dose was too high due to his advanced age and declining renal function. Drugs often exert their pharmacological activities at many different sites in the body or within several organs, systems, or enzymatic pathways at the same time. Some of these known pharmacological activities will be considered beneficial for the specific indication of the patient. But other predictable but undesirable pharmacological actions are considered side effects. However, drugs do not know why we sell them or why we use them. Drugs merely exert their pharmacology on patients. Sometimes the results are intended and beneficial. Sometimes they are not. Therefore, it is important for the clinical pharmacist to have an extensive and in-depth understanding of the pharmacology of the drugs of his or her patient is taking. Most side effects are predictable and therefore often preventable extensions of the known pharmacology of the drug, and these are very common if a drug dosage is too high. A drug therapy problem resulting from patients receiving a dosage that is too high for them is also a serious healthcare problem. For patients in pharmaceutical care practices, 5% of the problems were from dosages that were too high. These are the list of prescription medicines frequently associated with drug therapy problems of the category that is dosage too high. These are insulin, metformin, lisinopril, glipizide, furosemide, simvastatin, atenolol, levothyroxine, hydrochlorothiazide, and darbepoetin alpha. Drug therapy problems resulting from dosage that are too high are common and associated with considerable patient discomfort, suffering, and expense. These drug therapy problems are distinguished from ADRs because the cause and therefore their resolutions differ. DRP resulting from dosages that are too high for the patient are mostly commonly resolved by reducing the dose or by administering the drug less frequently. On the other hand, ADRs, type of DRP, are not related to the dosage of the medication, and therefore their resolution most often requires the discontinuation of the offending drug product and replacement with an agent from a different pharmacological class.